Good morning. Welcome to Sports Radio 1310, The Ticket. George B. John, Train Station Fitness Show at 7:01 in the morning. And we're talking today about something that you may be familiar with, you may have never heard about, and you may really not care. We're talking about celiac disease. What is it? Do you have the gene and the expression, if you will, by eating certain foods or having a certain lifestyle that can affect or exacerbate a condition you may not know you have, and all of a sudden it shows up and you have something called celiac disease? 1 in 133 Americans have celiac disease. 40% of Americans have the gene for celiac disease, but only 1% of those will actually get it. How do you get it? How does it show up? What are you doing to yourself that actually makes this disease or other diseases show up? So what I'd like for you to do today is I have Dr. Webster in the studio, and I also have my guest who'll be calling in is Melinda Dennis. She's a registered dietitian, and she's an investigator, researcher, and nutrition coordinator with the Celiac Center at Beth Israel Deaconess Medical Center. She was diagnosed with celiac disease 20 years ago. She also authored several journal articles on nutrition management of celiac disease, and recently co-wrote a book called Real Life with Celiac Disease, Troubleshooting and Thriving Gluten-Free. So now you have an idea of where we're going when we talk about gluten. If you don't know what gluten is, Dr. Webster and I have talked about it in the past. What is gluten, real fast, before we get into the meat of this?
The quick answer is just a sticky protein that's in grains like wheat, rye, barley, spelt. And it's a sticky protein that can disrupt your digestion. It can stick to the lining in your digestion. And some people, like you said, they do have this genetic disorder that starts to express itself called celiacs, which can completely, well, I'll let Ms. Dennis explain more about celiacs, but it can be very disruptive. But the great thing is, if you're not one of those, what is it, 130 people? 1 out of 130 people have it? If you're not one of those people, this show can still be very helpful for you. Maybe in preventing it from happening, because like you said, a lot more people have the gene for it than actually have the disease.
How many times have you and I, either whether we discussed it on the radio or off the radio, where someone can smoke or have a negative lifestyle and do drugs? You see some of these rock stars, and they're fine after so many years of abusing themselves.
Keith Richards.
Keith Richards, Keith Richards, still alive. He's like 135 years old.
He looks like he's 135, right?
And it's, you wonder how these people survive. Not only are they surviving, but they're thriving. They're doing well. Their body seems to have regenerated and staved off any illness or disease that other people now on the other side, where if they smoked for 5 years, all of a sudden they've got lung cancer. You know, or they've never smoked in their entire life and they have lung cancer. And it's so are you playing Russian roulette with your life? So while this show doesn't, even though it's about celiac disease, it also can be a type of show that makes you think about how you're treating yourself, and have you now turned on a gene to express itself, so to speak, in a way that will impact your life and people around you in a negative way, where you're now forced to change your life.
Right.
Just food for thought, right? Yeah. Pardon the pun, but I mean that.
And most of the time, when you're doing something that turns on this bad gene, it's something that you shouldn't be doing anyway. It's bad lifestyle that leads to this.
It is true, because years ago we didn't have the food, or we didn't have the conveniences. Let's just blanket it. The conveniences that we do today. So how is it showing up today? Why is celiac disease and other issues arising today? What is it? Fibromyalgia. Remember when doctors used to laugh at women? Years ago, they would give them a sugar pill or nothing at all, and say it's just in your head, because they couldn't diagnose what it was. And all of a sudden, one day, not only did people realize that it's real, but they put a name to it, and they call it fibromyalgia. So we can't laugh at what people are experiencing just because there's no name and we don't know what it is. We've got to recognize that we've got a lifestyle that's actually making us express certain genes in certain ways that we've never had before. Or maybe we've not been aware of before, it's never come out, because we've never had the conveniences that we have now. Right?
Great point. Yeah.
Isn't that a good way to look at it?
Yeah, it is.
So while you may say, George, I've never heard of celiac disease. Look, I want to lose 10 pounds before Thanksgiving comes. I don't care about this. You may want to think again. So let's talk with Dr. Webster and also Melinda Dennis. She's a registered dietitian. Coming up next, it's 7:05, Sports Radio 1310, The Ticket. 7:13, actually coming up on 7:14 if you're trying to set your clock. It's Train Station Fitness Show, George D. John. And I've got in the studio with me Dr. Jeremy Webster. And on the phone, we have Melinda Dennis. She's a registered dietitian. She co-wrote a book, excuse me, called Real Life with Celiac Disease, Troubleshooting and Thriving Gluten-Free. Melinda, are you there?
Yes, I'm here. Hi, George.
Good morning. Say hello to Dr. Webster.
Hi, Dr. Webster.
Hi, Melinda.
Hello.
So, Melinda, 20 years ago, you were diagnosed with celiac disease. I already teased this in the beginning of the show, and while there are millions of Americans who have the disease, I'd say it's not really a significant number compared to the amount of Americans that are in the United States. So if we have 380 million Americans and there's about 2 or 3 or 4 million people that have celiac disease, we might have maybe one of those people listening to us today. I'm not being insensitive, but why should the people listening to the show today listen if they don't know, number one, if they don't have celiac disease, they've never heard of celiac disease, or they don't particularly care because they want to lose 5 or 10 pounds prior, excuse me, prior to Thanksgiving? Why is this such an important topic?
Well, actually, at 1% of the American population, this is currently an epidemic, so that's one reason. And probably because so many of these people are underdiagnosed, many millions of people are actually suffering from celiac disease and don't know it. So if we can find them quickly, we can treat an autoimmune disease with a gluten-free diet and helps them to prevent complications of undiagnosed celiac disease, which we can go into later, but include iron deficiency anemia and osteoporosis and in some very, very rare cases, lymphoma or cancer, but that is a very, very small amount of the population. And then beyond that, so you have celiac disease, but you also have millions of Americans also suffering from non-celiac gluten sensitivity, which mimics the disease. It can be extremely uncomfortable and really decrease your quality of life.
Well, before we go further, Melinda, what are the symptoms of celiac disease? Let's say maybe somebody's driving in their car, they're going to work out, they're all working out.
Symptoms of celiac disease can cover the entire body, from the specific rash that I had when I was diagnosed. It's called dermatitis herpetiformis, an itchy, blistering skin rash that appears on your knees and your elbows and your scalp, the back of your buttocks, to liver abnormalities, to gas, bloating, loose stool, constipation.
Well, don't you think someone listening to the show right now might attribute that just to, well, it was a poor diet that day. They had some ice cream. It was their birthday and so on and so forth. And I know that we could talk about gluten in a little bit, but, you know, they might say, well, come on, is this really celiac disease? I've got some of these symptoms. I've had this my entire life, and just be kind of nonchalant about it?
That's a really good question to ask. If you've had those kinds of symptoms your entire life, you'd actually, I think you'd want to explore what that might be, because it's not normal to have stomach aches or loose stool or diarrhea or constipation for your whole life. But you're absolutely right. It doesn't have to be celiac disease just because you have a stomach ache on one day or you had a big, heavy meal the night before and you're absolutely miserable the following day. No. This is an autoimmune disease. It's genetic and it's extremely specific, as we know celiac. But sure, there's a million other things it can also mimic.
Hey, Melinda, before we go too much further, let's talk a little bit about what is the underlying cause of celiac. And I'm not talking so much about the genetic cause, but what is it that causes or triggers celiac? We haven't even really mentioned that yet.
Yeah, that's a great question. They believe it's 3 components. They believe that, yes, the genetics, which you just mentioned, absolutely imperative to have that. Then exposure to gluten is necessary at some point in your life, which for most people is when they're taken off their first baby rice cereal and put on their wheat cereal. And then they believe it's some sort of physiological thing, like an acute or chronic stress, or a difficult pregnancy, a difficult surgery, maybe a bacterial infection or parasitic infection that causes a lot of upset in your GI tract and sort of triggers this. So there's lots of reasons, and they're exploring all of those right now, but just looking at how gluten itself has changed over the last couple of thousand years is one of the big things that they're researching now.
So let me ask you. You say a wheat cereal. I know what that is. Tell people what a wheat cereal is, and let's get in, and then start getting into the foods that we know that can either turn on the gene or exacerbate the conditions that someone already has.
So for me, who has celiac disease, I can eat cereal that contains gluten, which is wheat, rye, barley, or oats, unless they're specifically gluten-free. So that would mean, all your high-fiber cereals that contain wheat flour. Like, I don't want to name names, but they're in every single major.
Melinda, name names. People need to know. Moms are listening.
Okay. So things like Fiber One and Kashi cereal, those are examples of cereals that have a wheat content to them. Even something like Cheerios, which is generally made from oats, will contain wheat, or oats which are contaminated with wheat.
So even the instant oatmeal is nowhere near as good, as we all know, as whole cut oats, but if it's got wheat, then it's not going to be good for you.
Yeah, and if you have celiac disease, you have to avoid oats even if there's no wheat in the cereal,
Right.
because oats and wheat in this country are grown on the same fields, so there's big risk for cross-contamination in the field, or in the truck, in the processing. So people with celiac disease buy specifically labeled gluten-free cereals, and when they purchase oats, they purchase certified gluten-free oats, and that shows that they haven't been contaminated with wheat.
Would someone in your position know, I think everybody on the show recognizes that when somebody says that there's an organic food, specifically fruits and vegetables, we have to take it upon ourselves to research it further to make sure that the food is really pesticide free. And we really can't do that. And we also know the FDA cannot police these farmers who say that they've got organic food. And I know this is a long statement and question, but would someone in your position know if you were going to eat organic wheat-free oats that were certified wheat-free? If they weren't, would the symptoms show up in your body and you would know that they were not?
Well, interesting questions. Like, that begs a lot of conversation, but if, 50% of people with celiac disease, almost 50%, have no symptoms at all, so it's very difficult for some people. You can imagine that it's difficult to stay motivated for some people if they don't see any symptoms or they don't see any immediate response to eating contaminated food or food that they accidentally eat gluten. But it shows up later in something like osteopenia or osteoporosis, which we know is a silent disease. Or they may not realize that their iron deficiency is linked to this. But so it's difficult. But yes, we can, because the FDA created a label about a regulation, about 6 years ago, declaring that FDA products had to list the protein wheat on the label if it contained wheat. That's made it a lot easier for people to avoid at least that one trigger.
Hey, Melinda,
then,
we all know, or a lot of us listening know, that wheat bread is obviously something that someone with celiac disease shouldn't be eating. But I've read a little bit about the different way that you make sourdough bread and you make things like sprouted bread. We know the sprouting process basically destroys a lot of the gluten. And when you make sourdough bread, you use a specific type of yeast that uses gluten as the energy source. I've seen some of my patients that are gluten sensitive, not with celiacs though, but are gluten sensitive, that can do pretty well on sourdough bread or Ezekiel bread. Is that the case with someone with celiac disease?
I'm so glad you asked that. It's absolutely not the case with celiac disease, though it can be true for people with non-celiac gluten sensitivity, or more commonly called gluten intolerance in this country. So no, we cannot eat any of that because we're talking about parts per million, which is, part per million is so small that, as you know, you can't even see that, and that's how you're measuring gluten in foods.
But it's a cumulative effect, right?
Yes, and it's also cumulative, absolutely, and dose dependent too.
Yeah. So, you know, one of the things I think that we all struggle with being professionals, even though I don't see people one-on-one anymore, but Dr. Webster does, and I'm sure you do, Melinda, is you said that if someone eats a particular food and they have celiac disease, it may not show up now, it may show up later in life. Well, the thought is, hold on, you know what? Everybody's getting cancer. Well, they're going to get cancer later in life. But you got to die of something. These are the thoughts, the caution to the wind. I'm going to live the way I want now. How do we, and I don't think we do, but how do you help someone to prioritize, to make this a priority and say, look, I've got to take my health in my hands now and make these changes now for later on so I can be an example for my children, so I can be an example for myself and others that may have this issue? Or do you not? Do you just let them go about life until they experience the symptoms and say, oh my God, I feel like I'm dying, I feel horrible, I can't work all day, I can't concentrate, whatever all of the symptoms are, feeling depression, feeling, you know, just horrible, right, and then they have to try to backtrack and fix themselves.
Right.
How do you do that?
Some of my patients have such dramatic symptoms when they come in that there's no motivation needed, right? Then the ones that do need motivation, I talk about the fact that we're so blessed to have a condition or a disease that is completely diet controlled. Unlike many of the other diseases out there that rely on medications, people can do something about this right away and can feel better, many people, right away. And then I also talk about the fact that since it's genetic, in many cases, you know, 1 out of 23 people at first-degree relatives have celiac disease. So you've got it in your family. So yes, you mentioned the role model piece, but it's just such a fantastic preventive measure for so many things that can develop if your celiac disease is left untreated that I never let people off the hook if I can be a coach for them or just be there on the other end of the phone to tell them what it's like and how it becomes like the back of your hand after a few years.
Well, and there's only one part what you just said I have to disagree with. I don't think it's like the back of your hand after a few years. I think once someone makes whatever that is a priority in their life and they begin to make changes within the first couple of weeks, and it's still a focus after a couple of weeks that they want to continue on, you've then got it down because you're into a routine. You get up, you do whatever you're going to do, you go to work. When you go to work, you take certain food with you instead of relying on other foods. When you come home, it's always on your mind. And when it's on your mind, you really don't fail because it's on your mind. It doesn't take a couple of years to know any of this stuff, whatever the routine is.
It becomes habit.
It becomes habit really fast. So we're talking with Melinda Dennis. She's a registered dietitian. She co-wrote a book called Real Life with Celiac Disease, Troubleshooting and Thriving Gluten-Free. My question for you coming up, Melinda, is should everyone, regardless if they've got that gene expression or not, for celiac disease and other diseases, should everyone stay away from gluten? Is gluten dangerous for everyone? We'll find out more with Melinda Dennis coming up next. 727 Sports Radio 1310 The Ticket. 735 Sports Radio 1310 The Ticket. George D. John, Train Station Fitness Show. Dr. Jeremy Webster in the studio with me. Also Melinda Dennis. She's a registered dietitian. Co-wrote a book, Real Life with Celiac Disease, Troubleshooting and Thriving Gluten-Free. Is your depression, infertility, anemia, or joint pain actually celiac disease? And that's what we're discussing today. If you've missed some of the show and want to get back to some of the information we've discussed, go to YouTube, enter 21-Day Body Makeover. You'll see all the shows that I've been doing and putting them on YouTube. You can also check me out on Facebook. Enter George D. John on Facebook, and I also load the shows. It should be up there today or tomorrow. Melinda, is she on? Hello. Melinda. Don't hear her. Dave, you're in trouble. Don't hear her. You got, all right, so let's do this. Keep going until she gets on because I don't hear her at all. But I asked a question. I know you'll know the answer to this. Gluten, all gluten products, which is the protein of wheat, does it affect everyone negatively, even if you don't have celiac disease or even the gene for it?
I think it does, and more specifically, I think the entire wheat product affects people negatively.
Now, there was someone on the show, and I'm interrupting on purpose. There was someone, I don't know, 2-3 weeks back, I had on, and we were talking about people who were affected by gluten, and they said and it was a male. Gosh, I wish I knew who it was. And he said the only people who are negatively affected by gluten are the ones that have a gluten intolerance, and that's only a certain percentage of the people who show to have that gene expression for that, not necessarily celiac disease. Melinda, are you there?
Yes. Hi, George. Hi, Dr. Webster.
Hi. So, and we were just discussing this. In your opinion, do you think everyone, no matter who you are, will have a negative response to gluten? Should everyone stay away from gluten?
No, I think that would be too much of a sweeping generalization for the U.S. public. Certainly, wheat's changed a lot over the thousands of years. We've modified it to have a high gluten content. That's one of the problems we're having right now. And certainly, people are eating far more wheat than they used to, and there's not likely a need for that. We can certainly balance that out. But no, there's no evidence to support that everyone should be off of gluten for whatever reason.
Now, Dr. Webster seemed to think that everyone, if I'm saying this correctly, will have some type of negative response to gluten today, and maybe because of the changes over the thousands of years. I don't know. If so, how has this shown up in your patients?
And the reason I'm saying this is because even if you don't have any kind of gluten sensitivity, which, by the way, is not that many people, when I do a lot of food allergy testing, and I'm seeing people having some type of response. It may not be the tissue transglutaminase test, which is one of the tests for celiac, but it may be just a simple IgG4 test saying that there's some kind of symptom, some kind of reaction to gluten. But even in the people who don't, which is, in my opinion, and what I'm seeing clinically anyway, is a small percent, even in those people, when you eat a wheat product, you're increasing your insulin level and your sugar level. When you increase insulin, a lot of bad things happen. Your arteries harden, your inflammation goes up generally. There's a lot of bad things happen. So I don't see any positive reason. There's not a lot of good nutrients in wheat products that you can't get in much more concentration from fruits and vegetables. I'm talking about the fiber, I'm talking about the B vitamins, I'm talking about the minerals. I just don't see any positive reason why we should necessarily. I know that 300 million Americans can't go completely off of wheat, but for our health-conscious listeners, I think it's a good idea for about everybody.
I don't disagree with that, and something you said earlier. George, I don't subscribe to dairy products, and when I have them, I don't do it because of health reasons. I have it because I want it, and I like that. If there's a food you like and you don't recognize that you have these negative symptoms from them, unless you have celiac disease, come on, let's be smart here, or some type of other negative symptom, and you just want it to have it. But if you're doing it because you think it's a health benefit, you may be fooling yourself. What do you think, Melinda?
Yeah. I mean, I agree with a lot of what you're saying. First of all, Dr. Webster and I know, do you have a clinical practice where you see extremely healthy individuals as well?
Yeah, both healthy and extremely sick people.
Okay. Yeah, so I agree that I disagree that wheat doesn't have nutrients. I think that one of the problems when people have to move over to celiac disease is that they're dumping something that is high in protein and iron and B vitamins. So we make an immediate effort to make up for that with the gluten-free grains like amaranth and millet and sorghum and quinoa and teff and buckwheat. But I completely agree that for many individuals, including those who have irritable bowel or who are having trouble with any gastrointestinal issue, and celiac disease has been ruled out, that they can experiment with a gluten-free diet or a low-gluten diet and may very well find great health changes for themselves. We deal specifically with the celiac population and the gluten sensitivity population, so I don't talk to individuals much outside of that circle.
Right, and Melinda, in my practice, I have primarily a weight loss practice, and what I see is even if somebody doesn't have any kind of gluten sensitivity, if you want to optimize your fitness and your weight, it's a nice way to do that is to get off grains entirely and to replace that with lower starchy vegetables and lower sugar fruits like berries. You get all of your nutrients from those foods, and you don't have any of the negative impact of all that high sugar and high insulin level that you get from the gluten. But switching gears.
But we also have to remember that a lot of people out there, because these are the patients I see, are choosing the refined carbohydrates. I mean, I think we should make a distinction for the public. between refined and the whole grains as well, if we're going to have this conversation, because a lot of people are eating, the white bread or the gluten-free alternative to white bread, which is just rice flour and potato starch flour. Those are going to raise insulin levels and cause weight gain and constipation and all sorts of things just as quickly as white bread would.
Sure. And a point we have to make here, people often think, and some of my patients have said, okay, Dr. Webster, if I can't have wheat, does that mean I can have white bread? People need to understand that white bread is wheat bread. Excuse me.
Exactly.
And Melinda, you probably teach your patient that those types of white breads are in fact made from wheat. They've just been refined down, and in some cases have even, from what I understand, even more gluten in them because of the refining process.
Yes, I couldn't talk to parts per million to that question, but it's a very big point in clinic that when you make a changeover, if you have to or if you want to follow the gluten-free diet, you have to be able to balance the nutrition out and not immediately go for the gluten-free alternatives, which are stocking the shelves. You have to look carefully to find the things that actually are whole grain. And Dr. Webster, to your point, there are people in my clinic who, once they go on a gluten-free diet, they find that they can't even tolerate those particular grains very well.
Guys, I want you both to talk about, excuse me for a moment because we don't have much time, Melinda. I want you both to share, or actually, Melinda, just rattle off if you would. For people who might be confused, what are gluten products? What products have gluten in them? When we're eating, we talked about oatmeal earlier. Rattle off about 10 of the most popular or more popular products that people eat that they're not aware of that may be affecting them in a negative way.
So communion wafers have wheat. Soy sauce is fermented with wheat, brewed with wheat. Of course, your crackers, your cakes, your cookies, your hot dog buns, your candies can be rolled in flour. Dates can be rolled in oat flour. Those are some. Dr. Webster, you want to jump in?
Some medicines, some vitamins actually have
exactly.
gluten to use as a
salad dressings.
Yeah, dressings, sauces, things that you would not think of as wheat products use gluten as a sticking agent. So you have to read the label carefully.
Now, if I'm listening to the show, I'm thinking, well, you know what? I'm going to turn you guys off because I don't feel like living in a freaking bubble. I don't want to hear that I can't have some of these things I like without experiencing some negative symptoms. And it's all about what's most important to you. Look, if you don't want to have the rash and the anemia, depression, pain in your joints and stuff like that, if you are experiencing those things, then take them out. So we have to have a balance with all of this stuff, and it really comes down to the person listening, to the patient, to the customer, the client, whatever they want to call them. Here's the other question I have for both of you. We're gonna go to a commercial. We'll come back, and I want you both to chime in on this. If I want you to talk about the tests, how people can be tested, what you should ask from your doctor to be tested for this. What are the best resources to learn about celiac disease? We'll talk about that. But my number one question is, do all doctors, nutritionists, healthcare professionals, registered dietitians agree with the protocol to alleviate the symptoms of celiac disease? Do you all agree of the same protocol? We'll talk more with Melinda Dennis and Dr. Webster coming up next, 745, Sports Radio 1310.
American Male.
752 Sports Radio 1310 The Ticket. George D. John, Train Station Fitness Show. Find me on Facebook if you'd like, and you can see the shows get put on there. Just go to George D. John. I'll friend request me and I'll accept you. And then you have YouTube. Go to YouTube, enter 21 Day Body Makeover, and you'll see some of the radio shows that are actually all the radio shows that are there. I've got Dr. Webster on the show, and also Melinda Dennis. She co-wrote a book that's called Real Life with Celiac Disease, Troubleshooting and Thriving Gluten-Free. My question to both of you, and I want you to answer first, Melinda, do all healthcare professionals agree with the same protocol to alleviate the symptoms of celiac disease? And who's right?
Oh, my gosh. But not to diagnose it, right, George?
Yeah.
Alleviate the symptoms? Okay, yeah. So, no, they don't agree. Your conventional doctors, if someone's diagnosed with celiac disease, conventional doctors will recommend going on a strict gluten-free diet. If someone has gluten sensitivity, celiac disease has been ruled out, conventional doctors will say that you may be able to tolerate a small amount of gluten, or certainly more gluten than a person with celiac disease at this current point in research.
And what do you recommend?
Oh, myself. I thought you was. Yes. I recommend that my patients, even with gluten sensitivity and not celiac disease, go as strictly gluten-free as possible.
Okay. Same thing, but I also recommend typically probiotics and glutamine products, which tend to help heal the villi. But I agree with everything she's saying. You've got to be
well,
really
then
strict.
I agree with that, because we use that too.
Sure.
What are the best resources, Melinda, for people to learn more about celiac disease, whether they may have it or not, or if they're dealing with it now?
Sure. The Celiac Disease Foundation, the Celiac Sprue Association, the Gluten Intolerance Group of North America, and then the National Foundation for Celiac Awareness. On top of that, I would suggest going to any of the celiac centers in the major hospitals, like Beth Israel Deaconess Medical Center, the Mayo Clinic, or Columbia University, for example, University of Maryland.
By the way, I love your website, Delete the Wheat.
Thank you.
.com. I love that. And if you want to get Melinda's book, you go to Amazon.com or reallifewithceliacdisease.com. Testing that you should ask from your doctor. Really, really fast. Do it, please.
Yes, you must test before you start the gluten-free diet. Otherwise, the test will not be valid.
Oh, good.
We recommend the total IgA and the TTG or EMA. And then if those are positive, elevated, we suggest the endoscopy with a biopsy of the small intestine.
You forgot the LMNOP and XYZ. So Dr. Webster has a very good point I want everyone to listen to. It's very important because it's the same thing for people who say they're vegetarian, yet they have 20 pounds plus to lose.
Okay, if you eat a French fry, a potato fried in trans fat, and you take it out and you sprinkle salt and MSG on it, is that gluten-free?
Melinda?
No, because the fryer is usually contaminated with other things like onion rings that have batter on them.
What if it doesn't? If you're strictly...
What if it's pure and you're making it in your own home?
Oh, it's just a horrible idea for a healthy food.
But is it gluten-free? He's making a point.
MSG, unfortunately, is gluten-free, so yes, it is a unfortunate gluten-free food.
Okay, the whole point of this was that while gluten-free is a great thing for people with celiac disease, and in my opinion for a lot of people, don't get suckered into thinking that gluten-free is synonymous with healthy, because there are terribly unhealthy foods that are technically gluten-free. And it also goes with low-fat, sugar-free, organic. You can eat terribly unhealthy foods that are all tend to be masked by these code words or these labels. So I just wanted to make people realize that there's this whole marketing campaign for some of these food manufacturers that they say gluten-free. That's not necessarily synonymous with healthy.
Something that bothers me about what Melinda Stennis said, and I'm really mad at you right now. I'm going to tell everybody, Melinda. You talked about Cheerios not being good for you, being a wheat product, but did you know that they're fortified and sprayed with vitamins? What are you laughing at? See, that's what people don't realize.
Celiac, George. People with celiac disease can't eat Cheerios. That's it.
Yeah, but see, here's the deal. It goes along with what Dr. Webster said. Just because the manufacturers found a way of marketing saying, well, hey, it can lower your cholesterol, but what else does it do to you in a negative response, number one? Number two, just because it says it's fortified with, I like watching how it's made on the Science Channel. And I like other just shows, documentaries like that. And one of the ones I saw was how they made a certain type of cereal. I think it was cornflakes, but don't hold me to that. It was about a year or so ago. And it said fortified with vitamins. And it showed as these cornflakes or whatever they were on the tray after they were cooked and went through this sprayer, the sprayer sprayed it with vitamins. Mm-hmm. What kind of person do you have to be to believe that that's actually good for you?
It's so hard for the consumer to understand the label, not only to get gluten-free, but then to understand all the health components to that. It's a good point. So we try to get our patients to eat as close to the ground as possible, and by that I mean using the fruits and the vegetables, the legumes and the beans and the healthy grains and the healthy oils, and we start there. And
you don't mean get on your knees and eat.
Yeah, exactly. Squatting. Right.
I like your approach, Melinda. I'm glad you weren't too resistant to what I was saying. I wasn't trying to say that your approach isn't completely valid. I was just trying to make a point, which you seem to now agree with, that just because gluten-free isn't necessarily synonymous with healthy.
Absolutely not.
We have not. We're not going to the next show yet. We've got about 30 seconds. Is there a point that you need to make for anyone listening that we've not touched on that you need to make right now?
I think that we need as many people who have celiac disease or gluten sensitivity to advocate out there in the world so that restaurant care gets better for us. Things have come a long way in the 21 years I've had this, but there's so much more to be done. So I would say advocate as much as you can for restaurants, for clinics to create celiac centers, and for people to explore more about what's being done to wheat, so that the rest of the population doesn't have to suffer in the same way that people with celiac disease do.
Linda, you have been a fantastic guest. Thank you so much for coming on today.